Governments are tonight raising an alarm over rising cases of the coronavirus pandemic, especially in 6 counties. The chair of the Council of Governors, Martin Wambora, says new infections are putting pressure on already strained county health facilities. Kiambu County, which has been classified among 6 counties with high rates of new infections, has closed several markets to contain the spread of the contagious Delta variant. Let's get more from our very own Elphas Legat.
Counties are racing to contain the Delta variant that is much severe in 6 counties. Mushrooming outbreaks of the deadly strain has prompted some counties to impose stricter COVID-19 rules. At the Thika Markets, Kiambu County, it is business as usual. County authorities forced to close down business stores. A recent spike in new infections has the county worried.
Hizi wiki mbili mambo haijakuwa mzuri. Mambo ni baya na tunaomba Mungu watu wasirikiane ili maneno itulie kidogo. In the last 2 weeks alone, 14 people have succumbed to the COVID-19 disease. Whereas the weather has been a major concern in Kiambu, medical experts link the recent political activities and a carefree attitude, especially among the youth, to the surge in cases.
Wameregea ama sisi kawaida wanadamu tumeregea, na kufuata sheria huwa ni jambo mzito sana, sijui kwa wanadamu.
Kuna kijana mwingine hapo garage ameaga. Kwa hivyo tuwaomba hata nyinyi watu wa kupiga dawa msiwe ati mkipiga leo hamtarudi tena, mwe mkikuja mara kadhaa.
The rising number of infections, especially in the counties, is putting pressure on already overstretched health facilities. The number of patients in need of oxygen and critical care on the rise. County hospitals have a total of 512 ICU beds. 192 of these are occupied with patients. In addition, there are 284 HDU beds and 162 already occupied with patients receiving critical care. The Council of Governors further revealing that the isolation bed capacity stands at 7,566, with 1,287 beds already occupied.
The higher number of infections, Nairobi City, Mombasa City, Nakuru, Kiambu, Nyeri and Kilifi. Currently, the positivity rate is 15.4%. This is very high.
Some people may claim that we have ICU beds, but are they all operational? Are they all fully equipped with enough human resource? We are actually in a crisis as a country.
The council says it is scaling up access of more medical oxygen in level 4 and level 5 hospitals, even as the KMPDU mounted pressure on counties and the Ministry of Health to prioritize better preparedness in the face of an imminent 4th wave.
County governments have actually failed to do what they ought to have done, and that's what has also led to the spikes in the COVID in the country. Because if they had the isolation units, they had the personnel, and they had all the requisite equipment, then the management will have been better than what we have today.
The situation is dire in counties such as Kirinyaga. 32 students and a teacher have been reported to turn positive for COVID-19. A county official who sought anonymity said many students at the Blessed Small Angels Academy were tested after they manifested symptoms of COVID-19 since 29th of July. The students found positive of COVID-19 have since been isolated. Day scholars quarantined at their homes and disinfection of the school done extensively. Meanwhile, Ministry of Health says 1,335 people have tested positive of COVID-19 in the last 24 hours. This represents a positivity rate of 17.5% out of a sample size of 7,605 tested. At the same time, the number of fatalities has increased by 30 after 1 death was posted within the last 24 hours, while 29 are from late audits. An additional 1,587 patients are admitted in various hospitals, while 1,093 patients have recovered. With counties reporting increasing number of new infections of the Delta variant, KMPDU is prevailing on both levels of government to step up. Elphas Legat, Citizen TV, Nairobi.